All right, it's 9 o'clock. Good morning, everyone. Welcome. My name is Pamela Gardner. I am the director for the Delaware Health Sciences Alliance, and it's my distinct honor and privilege to welcome you here today to our annual Delaware Day recruiting event for healthcare workforce in the state of Delaware. I'm joined by an esteemed panel of colleagues and partners in the recruiting sector of our health systems across the state, and we'll meet them just momentarily. First, I'd just like to share a little history for those of you who are new to the DHSA Delaware Day. We launched this in 2019, and we collaboratively bring all of Delaware's amazing health systems together for a collaborative and partnered event and initiative to recruit and attract and retain talent here to serve our Delawareans and our patients here and communities here that we serve. So thank you so much for taking time to be with us today. We are recording today's event. We are excited that we've seen an increase in our pre-registration for the event. We know that schedules are tough, and so we'll be sharing the event with those who may not have been able to join us live today. So if you're joining us live or joining us on the playback, thank you so much for your interest. We're excited to hear from our partners across the state, and we're excited to have you submit your interest to come serve our community. For those of you who are attending as attendees with interest in securing employment here in Delaware to serve in healthcare, please submit your letters of resume or your letters of interest along with your CVs or resume to pgardner@dhsa.org no later than Friday, January 27th. DHSA will then disseminate all of those letters of interest and CVs directly to our recruiting partners with us today. And we look forward to having you hopefully serve our community. A little bit about DHSA. We are a standalone nonprofit. We collaborate across the state, across our membership network, which I'll share here. This represents our members. We work across the framework of our membership and other strategic partners in the realm of pipeline development, workforce development, research, medical health policy. We advocate for what is best for Delawareans in the healthcare space and for the providers that are serving them. So thank you so much. Before I introduce our panelists and we hear more about the health systems with us today, I would like to take a moment to recognize, thank, and invite DHSA's CEO and President, Dr. Omar Khan, a friend, colleague, and mentor of mine. Dr. Khan, would you like to say a few words of welcome?
Hi, good morning, Pam, and thank you so much, everyone, for joining us today. It's a pleasure to see you virtually and to be part of this amazing program. A lot of the work we do in Delaware, we are really we're blessed to have that be conducted in such a coordinated and collegial fashion. Many of you are aware of the DIMER program, which is our program for collaborating across our institutions to make sure that our students, the best students from Delaware, are able to secure access to our partner medical schools, which are Thomas Jefferson University's Sidney Kimmel Medical College and the Philadelphia College of Osteopathic Medicine. And then we've really tried to, as part of the Delaware Health Sciences Alliance, create this arc of collaboration all the way from essentially from high school students when they first start thinking about medicine and making sure that we collaborate at the college level and to get them into our partner medical schools through the DIMER program, and then keep in touch with them through medical school and residency, and then finally bring them back to Delaware to serve our communities through your fine institutions. So you are a part of an essential arc of medical education, practice, and community wellness in the state of Delaware, which I know you are all aware of, and we're so appreciative that we're doing this in this joint and collaborative fashion. This really helps the applicants, it helps the state, and I'd like to think it helps all of us as institutions be able to tell our unique stories. There is something for every type of practice, I believe, in the state of Delaware, no matter where one wants to be. City, in a rural area by the beach. I think all of your opportunities reflect that. So thank you so much for making the time to be with us today, and really appreciate it. I'll turn that back over to Pam.
Thank you, Dr. Khan. I would like to take a moment before I introduce. I do just want to recognize all of our partners here across the state: Bay Health, BB Healthcare, Christiana Care, Nemours Children's Health, Tidal Health, Nanticoke, Trinity Health, representing and including St. Francis, as well as Westside Family Healthcare. So thank you to all of our amazing partners across the state for your commitment to this initiative and to serving Delaware. Without further ado, I would like to go ahead and kick off our introductions. Our partner from BB was called away this morning. Hopefully they'll be joining us later, but I do just want to go ahead and highlight their current and anticipated openings for physicians and advanced practice providers. If you are interested, again, in submitting to BB, please feel free to email your letter of interest along with your CV and resume to my attention at pgardner@dhsa.org. As you can see on the screen, these are the areas of interest, and just a little highlight of BB for those who may not be familiar with BB. BB is located in Sussex County in the town of Lewis, about half mile from the beach, and is seaside. BB is a 210 not-for-profit independent hospital that was founded in 1916. It is launching its family medicine residency program this summer in 2023. It has more than 45 primary and specialty care practices scattered throughout the county of Sussex with more than 200 providers. They are looking to add more and look forward to your interest. They are through a multi-million-dollar expansion, adding new surgical hospitals and state-of-the-art emergency department and cancer care centers. BB also has the Margaret H. Rollins School of Nursing on site if you're interested in teaching or leading in the field of nursing as well. So thank you to our partners from BB. And again, please feel free to submit interest to pgardner@dhsa.org for any of our partners today. For our attendees, please feel free to utilize the Q&A function of Zoom, and we'll address questions throughout the panel and discussion today. Without further ado, I would like to introduce Stacy Naylor. Stacy, thank you so much for being with us this morning.
Thank you. Thank you so much. I'm with Bay Health, with a hospital here in Dover as well as in Milford. Our Sussex campus opened the new hospital down there in 2019. Last summer, we began GME programs here for family medicine and internal medicine. This past summer, we added general surgery. Next year, we add emergency medicine. And then we're looking at a transitional year. So, if you're interested in education along with practice, we can certainly make those connections happen for people as well. We have 2 freestanding EDs, the first one being in Smyrna, the second one down in Milton. That's scheduled to open probably in April of this year, first of its kind in Delaware, with the emergency room and urgent care together. So people will be triaged appropriately and sent to the correct clinicians. And then attached to that, we'll have primary care and specialty offices also offered at that Milton location on Route 9. So very excited to talk with everybody. As you can see with our anticipated list of openings, we've got everything from anesthesia to CRNAs, licensed clinical social work, family med, internal med, emergency medicine. We can usually make a fit somewhere if you're looking to practice with us. We'd be glad to help you.
Casey, thank you so much. And what an exceptional overview of Bay Health and the incredible work and the opportunities that you have there. So thank you so much for highlighting that. I'd like to introduce Frank Gallagher and Lauren Mahaney from Christiana Care. Frank and Lauren, a little bit about yourselves and Christiana.
Yeah, hi, good morning, everyone. My name is Frank Gallagher, and I'm a senior physician recruiter here at Christiana Care. And I'll just add that I've been recruiting physicians for many years and feel very fortunate to have had the opportunity to do so here at Christiana Care for almost the past 5 years. As many of you know, Christiana Care is truly a dynamic place with quite an extensive network of outpatient and acute care and subspecialty services. And I'll also add that we are a not-for-profit health system and a teaching hospital with nearly 300 of our own trainees each year. And as Stacy mentioned, we too are happy to participate this morning and welcome the opportunity to hear from anyone with an interest in learning more about any of our areas or openings.
Perfect. And good morning, everyone. Lauren Mahani. Just like Frank, I've been with Christiana for 5 years. Excited to be here today. Been in physician recruitment for over, I would say, 15. And I'm the medical group TA recruitment manager. And as far as Christiana goes, it really is a special place to work. I mean, yes, we are nationally recognized as one of the top 50 hospitals in the nation. And that's been because of our caregivers and through our values of love and excellence, where we focus on population health, providing patient and family-centered approaches. We are champions of inclusion and diversity and equity in all the communities that we serve. And those communities and those caregivers, they keep expanding, which is why we're so excited to be here today, because we have so many new openings, a lot of them due to growth. 65 locations, 3 hospitals. We're in the 4 different states now between Delaware, Pennsylvania, Maryland, and New Jersey, and 1,300 caregivers, and we're looking for more. So excited to see who's interested in joining later this month. Thank you so much.
Thank you both so much for being with us this morning. I'd like to now introduce colleague and partner Fernando Mancata with Nemours. Fernando, thank you so much for being with us.
Thank you. Good morning, everyone. So my name is Fernando. I've been in physician recruitment or provider integration since the days where it was unheard to employ providers. So a couple of years. And so what is Nemours? Nemours is it's formerly the Alfred DuPont Hospital for Children. Started back in 1935 as an orthopedic pediatric institute in Wilmington, Delaware. It's grown into what's known today as Nemours Children's Health, premier non-for-profit pediatric children's healthcare system that focuses on specialty and subspecialty pediatric medical care for all children. We've got partnerships that include 72 care locations in 4 states. That includes state-of-the-art, standalone pediatric hospitals in both Delaware and Florida. You know, we've had the privilege of serving over 2 million patient encounters. We have a team of associates of over 8,600 that includes 1,130 or so physicians. We've screened for 50,000 social determinants of health. We've trained over 4,000 trainees that include residents, medical students, fellows, nursing students, allied health professionals, and nurse residents. With that being said, there are many opportunities with us that are not listed here, as you see here on your screen. So please feel free to reach out to us because it takes definitely a village to run a hospital, to run clinics, to give the best medical care. And we, you know, something that makes us unique, I think, is our culture. You know, we have a culture of definitely similar to others here, I'm sure. But I think, you know, our standards of behavior is something that drives our culture when it comes to diversity, equity, inclusion. And our CEO, Dr. Larry Moss, has put funds in investing in that. You know, we've hired our chief vice president, chief value officer that deals with value-based care. We've hired a vice president, a chief health equity officer that does strategic oversight of our diversity, equity, inclusion portfolio. So many great things here. And I'll end with our mission and vision. The mission is to provide leadership, institutions, and services to restore and improve the health of children through care and programs not readily available. And our vision, you know, is to go beyond medicine to create the healthiest generations of children. And that's going to take truly a village. That means partnerships with many institutions, some that are here. So thank you for this opportunity, and I hope to hear from some of you regarding any interest in working for Nemours Children's Health. Thank you.
Thank you so much, Fernando. And thank you for being here with Nemours. I'd like to now introduce Helen Conberry. Helen, thank you for being with us. Would you like to go ahead and introduce yourself and Trinity?
Yes, thanks Pam, and thanks you Omar for hosting today. My name's Helen Convery. I work with St. Francis. St. Francis is part of Trinity Health Mid-Atlantic, and they in turn are part of Trinity Health at Large, which is an 87 hospital-based health system throughout the United States. St. Francis is the smallest of our groups within the Trinity Health Mid-Atlantic region. We employ family medicine as well as OBGYN, and we are looking to grow both of those service lines. Family medicine and OBGYN practices are in Wilmington as well as in Newark. Both of our practices have undergone expansion and renovation. So we have beautiful new spaces and are looking for, as I said, both family medicine and OBGYN. Our OBGYN group is extremely experienced. They have a wonderful mentorship there. So we'll be looking for new physicians to join that are looking for that close relationship with their colleagues. And then in family medicine, we have our practice in Newark, which is primarily Spanish-speaking practice. And then in Folk Road, we have just a general family medicine practice. Myself, I've been recruiting for Trinity Health for 6 years now, and have been recruiting for physicians and nurse practitioners and PAs for 8 years.
Wonderful. Thank you so much. It's so incredible to hear about all of our health systems and how uniquely different they are, and the patients that they serve, but yet how similar they are all the same. So thank you all for being with us. Next, I'd like to introduce Jillian Dolan with Tidal Health. Jillian, thank you for being with us this morning.
Hi, everyone. My name is Jillian Dolan, and I'm the Director of Physician Recruitment at Tidal Health. We are a multi-specialty system that is in Delaware and Maryland. I am currently sitting in Maryland, but I'm 10 miles from the line, so I like to think I'm an unofficial part of the community. We have a hospital, Tidal Health Nanacook, which is located in Seaford, Delaware, and then our other flagship hospital, which is located in Salisbury, Maryland, about 30 minutes south. We also have about 40 and growing ambulatory locations. I feel like every time they give me a number, the next day it increases throughout lower Delaware. I think the best part about Tidal Health right now is we're in a really exciting phase. Tidal Health became a system about 2 years ago. 3 now, right? January 2020, we brought out the new brand and, merged the 2 hospitals and lots of locations throughout. And this little thing called COVID hit. So we've kind of pumped the brakes and had some things going on. So 2023 is really a year of growth and making sure that we have great partnerships with our providers in the area. This, as you'll see on the screen, is a list of some of the specialties that we are looking for, but I would say my favorite part of recruiting for Tidal Health is the leadership's ability to always lead with, yes, let's see what we can make work. So I've had lots of, providers reach out and say, I'm looking for a position here and referral from your hospital, and they really like your location and everything you have going on. And so it's not unheard of for us to try and find spots for people that aren't on our list or aren't, posted things that we were looking for. So we understand that providers and physicians are the backbone of our company and in the leader of having, commitment to the mission of offering care throughout our region. So please reach out if you have any questions. We'd love to hear from you. We have about 300 providers right now within our system and growing. We have emerging GME programs, internal medicine and general surgery right now, and 3 coming up in the next 1 to 2 years. So teaching is going to be a huge part of our culture as well. So I appreciate you guys having me. If you need anything, let me know, but I look forward to learning a lot today too.
Thank you, Jillian, for being here and for making sure that Tidal is represented in this initiative. So thank you so much. I'd like to now introduce Kimberly Wright with Westside Family Healthcare. Kimberly, thank you for being with us today.
Thank you so much for having me. It's so good to be here. So good to see you guys. Well, Westside is a community-based healthcare, and we have 5 locations. We have 1 in Dover. We serve Bear, Newark, and 2 in Wilmington, our 4th Street location and our Northeast location. The pride that we take is that we do serve the underserved, and we are very good at that. We also pride ourselves in being able to reach out and have community with other sites and locations and the hospitals, and we partner with Christiana, and it's been so good. And our provider population has grown, and we welcome you to apply at Westside Family Healthcare. I have been serving them for 4 years now as the HR manager, and we are growing by leaps and bounds. This is our 35th year in serving our communities. So we welcome you to reach out and learn more about Westside Family Healthcare. Thank you so much for having me.
Thank you, Kimberly, and thank you for representing Westside and ensuring Westside is included. We are so grateful to all of our panelists and all of our partners here today. We couldn't do this without you, and we need your help, and so thank you so much. And for those that are attending here, I hope that you heard just a snippet about how incredible all of Delaware's health systems are, and that there, could be potentially a place here for you. And we have so much to offer. And being a small state, we have, I think it's 7 health systems represented today, all uniquely different. And so there may be a fit here for you, and a fit, similar. So thank you so much. I do want to iterate, I've heard from several of our panelists and recruiting partners say that if you are interested in their health system, but don't particularly see an opportunity listed, to not shy away from submitting, right? Please go ahead and submit your interest and or reach out for more information. So please don't be shy. Again, if you're interested in any of the health systems or opportunities highlighted today, please submit your letter of interest, resume and or CV to pgardner@dhsa.org, and we will disseminate appropriately for interest in an area of the state that you're interested and or to all. Without further ado, I do want to just encourage folks to submit their questions through the Q&A. We did have some questions pre-submitted with registration. And so it's now my distinct honor and pleasure to re-invite Dr. Khan back, who will lead and facilitate this portion of our morning together. Dr. Khan?
Great. Thank you so much, Pam. Just sound check wise, can you hear me okay?
All sounds great. Thank you.
Okay, great. So Pam, in terms of I think, responding to some of the some of the questions on the panel, I think what we might do is, and really for everyone here, feel free to jump in, or because we're 7 people, I think I can see everyone, but if you'd like to use the raise hand thing, please do that, and Pam and I will try to make sure that whoever is wishing to respond gets the opportunity to do that immediately. Just like Fernando said, I've been around for a while. I'm a Delawarean, grew up in North Wilmington, and went to medical school, actually not part of the Dimer program at that time, but went to medical school at the University of Vermont, did my residency there, did my public health training at Johns Hopkins in Baltimore in public health, and in geriatrics at Hopkins as well, and then eventually came back to Delaware. And there was a time when things were very different in terms of recruiting. This level of organization didn't exist. Frankly, this level of organization in patient care didn't exist, right? It was mostly independent practices. And that's in fact one of the questions that's coming up around what does that look like for independent practices collaborating with health systems? How do people, how would we entertain folks who are coming from independent practice into one of these positions? We are seeing a lot of flux. Because we work as the Alliance across the entire spectrum of learners and providers and physicians. As I said, we start with high school, medical school residency, and then get you terrific practicing providers. We kind of work with the ARC, and I've seen that ARC change somewhat over the years. Today's providers and physicians are looking for perhaps different things than the ones who were of my generation, or maybe some of the ones that you guys have worked with 15 years ago. But you're on the cutting edge, and you know what is attracting the best and brightest back to our Delaware communities. And I have to say, just looking at the array of opportunities, there's never been a better time to practice in Delaware. The breadth of opportunities that's available here is tremendous across all 3 counties, and in some cases, opportunities that straddle county lines and even state lines. So thank you so much for doing that. Let me see if anything here. So one question is coming up. The first question is actually through the chat, and Lisa's asking around a question that other panelists have as well. So I'll throw it out to everyone here, which really is about family medicine with obstetrics. And just to clarify for colleagues whose health systems may not be doing that as much, the specialty of family medicine traditionally, when I trained in it, I did family medicine full service with obstetrics, and that is considered quote unquote full service family medicine. It's very environmentally dependent and institution dependent, but many institutions do offer the opportunity to do that, whether through their own group or through partnerships, as several of you know do that as well. So I want to just put that out there, and perhaps we'll start with Helen, if you don't mind me putting you on the spot, because I know St. Francis has a very robust program overlapping both in family medicine residency with obstetrical training. Do you want to take that, if there are opportunities for a family physician who wishes to do obstetrics?
Yeah, we actually do have our physician, Dr. Gutierrez, does that at our Center of Hope practice. And she does not go onto the labor deck herself. She does remain in the ambulatory setting, but she does see pregnancy through term, and then works very closely, obviously, with our OBGYN team to kind of transfer the patients at time of delivery. Our family medicine faculty, which I do apologize, I forgot, we do have a faculty position available with our family medicine residency. They are obviously doing some OB rotations through there. And then we also do have some of our family medicine physicians that just do see some OB patients as part of like some clinical sessions. They're in the faculty for the majority of the time, but they go into the clinical setting or broad practice and are seeing a lot of OB patients that way. As I think a lot of my other colleagues have said, there's always an opportunity to have a conversation to see what type of medicine and practice fits for our providers so that they feel successful in their practice.
Thank you so much, Helen. And along the similar vein, as I mentioned, St. Francis, as in fact the oldest residency program in Delaware, has a long tradition of full practice family medicine training at the attending level and residency level. But there are other models with which, even though the institution may not do that in their own group, they partner with others to do that. So one partnership like that is Westside and Christiana Care. So would Kim or Frank like to speak a little bit about that? I can certainly speak about that from the academic side, but Kim or Frank, would you like to speak about anything primary care with women's health interests in the ambulatory setting or otherwise?
Yeah, thank you, Dr. Khan. I'll be happy to chime in here. And I would say, in general, I agree with you. You're seeing this less and less, of course, as a formalized structure. However, the same way I would recommend that anyone who has an interest in any area to reach out, even if there isn't a prescriptive listing for that opening at this point, I would say if someone does have an interest in combining those two specialties, that's many times the best way to get the ball rolling in terms of putting something together that would meet those needs. So we do have a little bit of history in terms of combining those two specialties. And because of our two groups, our family medicine faculty group and our larger OBGYN group, I would say it's certainly, worth a discussion.
Yes, and we do partner with Christiana Care on that as well at Westside.
Thank you, Kim. And it's a robust partnership there that includes a residency partnership. There are attendings at Christiana Care, such as Dr. Antel, who do that obstetric model, such as what Helen described, which Dr. Bob Monteleone does at St. Francis. Folks like Dr. Karen Antel do at Christiana Care. But Lisa, I would encourage you to think about what that looks like, really the full spectrum of primary care as we care for people in the ambulatory setting. It really has changed quite a bit. We think that it's probably really tough for one person to do it all, unless they're in a very rural area where by necessity they may have to. But in a place like Delaware, increasing the model really looks like, of course, get your excellent family medicine training and learn about women's health. And in the ambulatory setting, you're going to do a lot of outpatient gynecology. Every one of the practices here that is highlighted, I believe all of them offer their family physicians the opportunity for outpatient women's health to see their female patients for routine women care. And I think that's a really important piece of the training and a lot of what the future family physician is really going to be asked to do. Would any of my other colleagues, Stacy, Jillian, others, like to chime in with their primary care women's health opportunities? Jillian, go ahead.
Hi, thank you. Sorry, I'm trying to work this raise hand thing. I don't want to cut anybody off, but yeah, so I would say that historically, we haven't seen any of the combination come through, but as our OB-GYN service increases and our need in the Nanticoke Hospital increases as well, it has been something that's come up in conversations. So kind of going off what Frank said, I feel like it almost sometimes starts with a candidate and a need from a candidate, and then we go from there. So it's interesting to know that even on like the admin side, it's been coming up in conversations. So it makes me excited to know that, you know, people are interested in filling that role as well, because historically it hasn't really come up very often, but I think it's coming back around.
Thank you, Jillian. So, Stacy, please go ahead.
I'm sorry. We've expanded women's health significantly down at our Sussex campus, adding midwives, but in addition to that, we have new primary care offices opening in Dover at the Blue Hen Center, and we'll have a mix of family med and internal med doctors, but our leadership is always encouraging, you know, if there's something you're passionate about and want to incorporate it in your practice, we can figure out a way to make that happen and support it. So I would say, you know, just depending, I think, on where you want to live in Delaware, I think probably most any system who's represented here could certainly help you, Lisa.
That's very helpful. Thank you, Stacy. So we have a couple of other really good questions coming through the chat here as well. Let's see, we have a few. So let me jump first to patient population. That's an interesting one. So we've also seen a shift in terms of what our current folks are looking for, as you have seen, in terms of serving a diversity of patients. And they are increasingly you know, it's tough to imagine that I got into med school. I don't think I would today. These guys are coming out very well trained. They're proficient in different languages. They're proficient in cultural competence, and it's remarkable to see the growth that's happened in that area. So the question is around the diversity of patients that the institutions serve and the opportunity to work with patients from minority backgrounds, from Latino backgrounds, maybe the opportunity to work with the Spanish-speaking population. So I was wondering if folks would take a couple of minutes to highlight those opportunities. And in children's health, I think this is particularly important because you're working with multiple stakeholders in the exam room. You're working with the child, you're working with the parents, and family care in a diverse environment is really important. So maybe I'll start with Fernando. If you'd like to speak a little bit about the diverse groups of patients that Nemours serves in its various settings. And again, this question, I think, is mostly towards outpatient ambulatory care.
Yes, so I think we need to step back and just look at the population of the United States. It has drastically changed over the years. You know, we as healthcare system need to do everything we can to make sure that the patients that we're serving and their family is reflective of when they go into a doctor's office or the front office, that they can see someone that they can relate to. And whether it's a language, whether it's culture, all of that helps with the end product, which is to improve the lives of whoever that is, whether it's adult or children. In our case, it's children's, right? We want to improve the lives of children's in their health. That means that it's a total holistic approach, understanding the family, understanding the culture. And Nemours is very unique in that when you come on board at Nemours, we have an indoctrination that takes between 2 to 3 days of educating people of who we are and how we interact with each other and how we interact with our families and their children. Standard behavior number 5, which is respect and leverage separate realities. All of us here have different education, belief systems, life experiences. that give us a lens of how we see things, whether it's patient care, whether it's medicine, or whether it's technology. Everybody comes to us at a different perspective. So that's why it's important to be inclusive. And the patient population that we deal with, the payer mix, I mean, Medicaid is huge for us when it comes to children. And there are a lot of social determinants that is, by the time they come to our office, that have led them to be in the state that they're in. So we take it upon ourselves to partner with other institutions that aren't necessarily medically inclined, whether it's food, whether it's just other kind of shelter, et cetera, et cetera. All of those are social determinants of health that have an impact on the health of children. So that's huge for us. I hope I answered the question.
Fernando, thank you. I think that's very important from a values-based perspective. And from the perspective of serving, in this case, let's just say, folks who are from rural communities, that is also a very important type of diversity, whether we're serving rural farm worker communities and others. And so I wanted to give our colleagues who serve that group a chance to answer. I think I don't want to mention Kim's response first. Kim Wright from Westside. Kim, would you like to speak about Westside? Please go ahead.
Yes, I would. So our frontline staff, which we take pride in, are all bilingual. So when you first come in the door, you're immediately greeted with someone who speaks both languages. And then most of our medical assistants, as well as some of our providers, are also bilingual, but we also offer those things, the facilities you can use, the iPad for translation, the phone line for translation. So always being able to connect with our patients, that is one of our requirements, that all of our frontline staff be bilingual and take pride in that. And we do offer the mobile health unit, which resides in Dover. And we do go out to the rural areas and serve the farming community, make sure they have all their vaccinations, make sure they have everything that they need. So it's a good thing. So, and I echo what Fernando was saying as well, like, the total need of, if it be food, we offer that. We have the community refrigerators. Folks can just come and get what they want. We do give the kids coats. This time of year, we give them gloves, backpacks, things like that. So yes, people feel comfortable coming where they can be understood.
Thank you, Kim. And when you say bilingual, I assume the other language is Spanish.
Yes, Spanish and Creole. And we have a couple of French speaking folks as well. So yes, but mostly Spanish and English, yes.
Very good, thank you. Lauren, I see your hand. I'll get to you in just a minute. I just want to jump back to the thread around rural programs as well. We're concerned about in Delaware serving underrepresented minorities and underrepresented geographies, which sometimes overlap and sometimes don't. But the rural communities are as important as any other in Delaware. So let me give my colleagues from Kent and Sussex perhaps a chance to weigh in there if they would like, along the lines of serving folks of diverse backgrounds, whichever they may be. Jillian, please go ahead.
Thank you, Dr. Khan. Yes, so we are located all over kind of lower Delaware. So we have sort of the rural and the Hispanic culture kind of throughout. A lot of, the Purdue farms are close by, and the workers are being, treated in our outpatient offices and our Nanticoke Hospital. So, I mean, having providers that are interested in serving underserved communities and, having the bilingual background is a huge asset in our location, because, it's most of the mix that's going to reach out to you. But it's also kind of a funny situation in lower Delaware is you see a lot of everything. There's also the population that's moving down to the beach too. So there's a lot of people that aren't even, they're from New York and Connecticut, and they're moving down and they're not familiar with the area, and, still have certain questions about where to find care. And so Delaware in general is just like it's a funny little area that has a little bit of everything. But, in the lower and Sussex and the lower Delaware area, it's just each day you'll probably see a couple different languages, a couple different, outstanding communities as well, because they have to travel. I mean, that's part of the mission of Tidal Health in general. It's part of the reason that we merged, because we're stronger together. So the hospitals merged and the outpatient offices all came together to hopefully have great care for the lower community so they don't have to travel too far for care.
Very good. Thank you very much, Jillian. Lauren, let's jump back to you around Christiana Care and efforts at diversity and inclusion and opportunities that our graduates might have in practices of Christiana Care to serve diverse communities. Please go ahead.
Absolutely. Thank you so much for the question and for the opportunity to talk a little bit more about it. The diversity and the variety of the patient population is amazing. As I mentioned earlier when I was introducing myself, the 4 states that we serve, the 65 ambulatory practices, the 3 hospitals with the 1,300 beds, whether you are practicing and or serving suburban, urban, rural populations, that diversity of patients, that diversity of cultures is an absolute melting pot and easily obtainable here. If there is a certain type of diverse patient population, especially with some of our positions that we have high volume hiring in because of the exponential growth, you can target certain locations. You can target Center City, Wilmington, or the newer campuses or the ambulatory sites. So again, like we were echoing in the beginning, as long as there's transparency between the individuals on this call and the recruiters like us, we can make something happen. And with the talk around language, it made me think of a wonderful story. Jackie Ortiz is the VP of Health Equity and Cultural Competencies with Christiana, and we were partnering with her team. The recruiters came together with the Health Equity Cultural Competency team because there's a practice that is pretty much 99.99% Spanish speaking, which is Centro de Salud. And in order to cater to that population of patients, every person from the office assistant up had to be, Spanish speaking at some level. So Jackie and her team partnered with us to identify a process to vet out and qualify the levels of the candidates and their abilities to converse in Spanish or go all the way up to medical conversation. And so that way we were able to provide the patient population with the individuals they needed that can communicate properly and effectively. So sorry, a little bit story on Jackie's team and a little bit around answering the question there. And then if I may, just for one more minute, this is a huge passion, a huge focus for all of the recruiters, not just the patient diversity and population, but also that of our caregivers. I'm hoping I'm going to get the opportunity to talk more about it later on in this session, but we also have something here called employee resource groups. And so those resource groups, our caregivers make up these groups, and the different groups are off ethnicity, gender, age, religion, class, culture, disability, and sexuality. So you as an individual, when you come to Christiana, your diversity is also honored and championed if you'd like to join one of these resource groups.
Thank you very much, Lauren. That's very helpful. And I think from the applicant's perspective, these are exactly the kind of responses that you want to have as you go into a particular healthcare system. I think you really want to learn about the opportunities, but start off with the values and behaviors. Start off with how you feel as you walk in through the door. Is it a welcoming place for everyone of diverse perspectives? And then go a step further. What are the patients actually like? What are the providers like? And then see what are the systems put in place. You've heard from your colleagues here about the iPad, the iPad on a stick concept is one many health systems use now, because no health system in the world has every language in the world at their disposal on staff at all times. It doesn't work that way. So some places, like say, the ones you've heard about, may offer bilingual services on site, or maybe even 5 or 6 on site. But for everything else, the iPad on a stick concept allows us to connect with vetted translation services, then connect you to a translator in virtually every language spoken by our communities. And that can be very, very helpful. And I think that's the big part of it. When I started medical practice at that point, language skills were not as important, but it has become much more important. So when I started, I like to say, it was more around Spanish, for example, which I tried to learn. It was more like, mi español no es bueno. And that, for those of you who speak Spanish, just means my Spanish is not very good. But then it changed to pero estoy aprendiendo, which means but I'm learning. And I think that's really important. So we're all learning, even though we may not start from the same place to begin with. So thank you everyone for your responses there. Let's move to a couple of other questions here that folks have around work schedules and flexibility. And this is perhaps a group of what we used to call the quote unquote lifestyle questions, but they're actually professional balance questions. The demographic of our medical providers has changed. Just as an example, the DIMER program, when I was applying to it, had about 70% males and 30% females. And now it has almost flipped. It's 55% women and 45% men. And those are self-identified characteristics. So the diversity metric is thankfully mirroring a lot more of what we look like as a country and a community. We're not quite there yet, but we're getting there. As that has changed, so have the demands on the family. We have dual income households. We have both parents sometimes who are working, and that needs to be reflected in our workplace opportunities. So I'd like to open it up in terms of any special opportunities that your health systems might offer for folks who would like to have either a part-time or a flexible schedule around their physician work hours, and what opportunities there may be in that area. We'll start with whomever would like. If somebody would like to jump in, please go ahead.
Hi there.
Let's see, we have Stacy and Jillian. Stacy, please go ahead.
Okay, sure. I think recently we've seen a lot more physicians and even our APCs, talking about being less than 1.0 FTE, whether that's a 0.9 or a 0.75, or, we've really taken a look at the value that each person brings to the practice. And it's better to have, 2 part-time folks that are happy and fulfilled in every area of their life than to have one person who's kind of trudging through making it work, right? So I think we've taken a hard look at that and really compromised kind of where people are at today. In addition to that, one thing that we do have here at Bay Health is an on-site childcare center here at Kent. It's a Bay Health employees childcare center. It's a 5-star rated system. They're open 7 days a week. So we definitely cater to our schedules. They open at 6:30 in the morning, open till 7 o'clock at night. So depending on what your schedule is, I think that our leadership has definitely placed a lot of value in that. All of the caregivers there are educators as well, so they all have 4-year degrees, and kids start learning in the infants room. So if you have family planning and things like that, or planning a family in the next few years, we have some resources here that I think aren't offered everywhere. But when we do mention it to candidates, like when they come for an on-site visit and things like that, it's definitely one of the things that they're like, wow, that's great that you have something like that right here in your community. In the next year or so, they're probably expanding to have a second site down at our Sussex campus and maintain that 7-day a week too. So I think the split schedules and things like that sometimes aren't a consideration of corporations. As a community hospital, I think we try and focus on making sure that there's certain things that you don't have to think about and don't have to worry about. So.
Thank you, Stacy. Thank you so much for mentioning that. I actually didn't know about the program, but I do want to highlight that for our other recruiter colleagues as well, not to underestimate the value of on-site childcare. I know not everyone's able to provide it, but I got to tell you, if you are, that's a massive recruiting benefit. Just from my perspective, when I was a young parent caring for my son, I structured my work hours. It was relatively unpopular, frankly, among male physicians to do that at that point, sadly. But I structured my work hours. So I'd drop him off to elementary school in the morning and then pick him up after work. So I had relatively limited, work hours between kind of 9 and 2:30. That was okay. I got to nap and swim with my son. It was pretty fun. But at the same time, my on-site childcare was my office for him. If he had a day off from school, I'd have to bring him in. I'd stick him with the front desk or in my office, and while I saw patients, that's kind of how many of us did things back in the old days. So, Stacy, just to go back to you for a second, for our applicants who are looking for jobs at the campus where the childcare center exists, they would be eligible for and likely to receive a childcare spot.
So we encourage, if I always tell anybody who's interviewing, if you're considering signing, we encourage you, especially for infants. There are some wait lists depending on age groups. But I know when I started here at Bay Health, I think I started in the month of July. My sister is a kindergarten teacher locally, and she said to me, "You need to get Isaac on the list," you know. And I was like, "Well, I'm okay where he is now." And she's like, "No, really, it's a great center." And he was in within like 4 weeks. So there is sometimes a wait list, you know, depending on the age group and things like that. But because of that demand, we're also expanding our current center. I think they have 70 spots now. The director said last year they're expanding to, I think, 130 and going up to before and after school age care as well. So, you know, like I said, the leadership has definitely taken a look at, you know, things that our providers all need, and you know, what weighs on your mind. And if it's not a work issue, it's a family issue, right? So if we can help support in that way, I think our leadership's really great about it. I know our CMO actually, you know, dressed as Santa Claus and did some surgical rounds the day before, you know, the holiday break this year. And he actually went over to the child care center too. And he said it was probably the best gift he could have given himself. So it was a lot of fun, you know. So I think
wonderful.
I think it brings value in ways that maybe don't show on paper and in black ink and red ink. But you know, when your family's taken care of and safe and healthy, I think it's definitely reflective in the ease you bring yourself into the office. You know what I mean?
Sure. Well, thank you. Well, we look forward to seeing Dr. Siegelman's photo as Santa Claus at some point.
I don't know if I can share that, but I've seen it and it's really good.
Fair enough. Jillian, would you like to speak about titles, work in this area, and then we'll go to Fernando after that.
Sure, thank you. Yeah, I wanted to kind of bounce off what Stacy was saying, and we also have on-site daycare, which has been a huge asset to our providers and nurses and admins, everybody, you know, that's a Tidal Health employee. We have a growing location that you can, you know, utilize. And it's actually, I'm home today, but in my real office, it's, you know, on the first floor. So you can run down and say hi to the kiddos. You can hear them in the playground outside. So it's a huge part of the work-life balance that we offer. I also wanted to say that conversation of wanting to work part-time comes in a couple different waves. So we do have the providers that have young families, and maybe both spouses are providers and one of them wants to go part-time. That happens. I feel like I have that conversation daily, that, you know, the whole family's coming and moving to the area and we want to work our schedule around the children, and we're always happy to do that. The other thing that comes up a lot too, you know, is because of where we're located, a lot of providers wanting to slow down. They have worked really hard for 15 years and, you know, they want to move closer to the beaches and have Delaware taxes, you know, be in that wonderful bubble and be close to the beach. And so we run into that conversation a lot too. Like, I'm looking for 3 days a week for the next 5 years. And, you know, what can you provide there? So that's always a conversation that we're open to having too. And the most important part is just making sure that, you know, the providers are transparent with the recruiters, because we're your advocate at the centers. You know, I'm going to go to Tidal Health and say, this person is wonderful. Please make sure we make something available. I also wanted to say another thing that we come into too is people that want to have leadership. So maybe they want 3 days clinical and 2 days in the admin role. So that's something that we kind of gauge as well, because we do have medical director positions available that, you know, we're looking for people to grow within Tidal Health. So it's interesting, but there's lots of different ways it can be solved, and, you know, we're always flexible, and I don't think candidates should be shy to ask for what they're looking for.
Thank you so much, Jillian. And you've anticipated one of the other questions around this, which is the opportunity for leadership, so which we'll get to in a couple of minutes. So I think Fernando was next. So Fernando, please go ahead.
Yes, thank you. So let me start by saying that if you want to not be part-time, you absolutely need to say that in the beginning, and you'll be surprised at the response. The culture here at Nemours is absolutely, we want to get you in here. We want to be flexible with you, because the reality of the world we live in and the market is that talent is, especially good talent, is very difficult to get. The United States, relative to other countries, we're not having a lot of babies relative to other countries. So the workforce is decreasing over the years. So I have the culture has changed over years. As I mentioned earlier, when I started this in this industry, it was unheard of to employ doctors, to compensate them for taking ED call, unheard of. Now, that's very normal. Now, fellow people that are finishing their fellowship are coming in expecting to talk about how do you as a institution address the work-life balance, and whether that's coming less than a 1 point FTE, whether that's we have reimbursement for childcare. We have a white glove program where if you need not only childcare but even adult care, because we're aging, right? We have parents too. So we will help you facilitate and get that organization and those services for you. So definitely very flexible. And I think everyone, if you want to be in the game and have talent to be able to take care of the needs to your population, you're going to have to be flexible. And the culture has changed. So we definitely are an institution that has that culture of being flexible, understanding that it's very important to have that work-life balance, and that you do have a life outside of your job.
Thank you, Fernando. Thanks, that was very helpful. And especially being a children-focused institution, I'd imagine you'd want to be appropriately attentive to the needs of those of us who have them. Lauren, would you like to speak about Christiana Care's efforts in this area to provide that work-life balance for your new recruited providers?
Absolutely. So work-life balance is such an important topic. No provider should shy away from wanting a healthy work-life balance. And that term means something different to every single person who hears it. So in order to be both personally and professionally satisfied, Christiana wants you to bring your whole self to work and not have to put on the work mask and then the out of work mask. So as long as that transparency piece, as I had mentioned earlier, is brought forth on day one, we can figure out ways to facilitate. And that means, using your recruiter at Christiana as your champion, but also the leadership there. The leadership is extremely open, extremely receptive. They don't have a crystal ball. They don't know what's going to make every individual happy. They know everybody's an individual, but they need to know the specifics around that in order to try to partner together and to deliver. And to talk about the flex schedules and the part-time, absolutely. We have full-time. We have full-time flex. We have part-time. We have moonlighters if you want to only do that, or maybe even pick up extra shifts. With part-time at Christiana, anything less than 1.0 is considered part-time. We have that full array of anything from a 0.1 up. As long as you're working at least half time at Christiana, so a 0.5, you have access to full benefits, which is also a huge thing if you need to carry the benefits for the family. As far as benefits go, also for our full-time providers, anything less than full-time would be prorated, but it's 32 days of paid time off a year that you would accrue. And then also up to 12 weeks on top of that 32 days, 12 weeks of 100% pay and job security for parental leave. So that also goes into that flexible schedule, that work-life balance, where we want people to be professionally satisfied and also personally satisfied.
Thank you, Lauren. That's very, very helpful. And thank you everyone for sharing these opportunities and sharing your commitment to work-life balance. And we know that in a place like Delaware, that is very valued anyway, because we are a community of communities. And I think this type of approach is very helpful to our new recruits coming in. So just continuing along the thread of what graduates are looking for as well. As we know, it's much less about simply compensation and hours. It's about everything else that we just spoke about as well. So I'm wondering if each of you could highlight a little bit about your programs in terms of what is there in the 15-20 mile residential radius that folks actually like to participate in. What do they like to do? And I know that some of this is out of the control of our health systems, and as part of the Alliance, we've been working closely with the state of Delaware and with counties to figure out what does the lifestyle around your health systems look like? What does it look, what does the Main Street look like? Do they have opportunities that today's graduates are seeking? And, some of that has changed and some of that needs to continue to change. At the same time, I think we have tremendous assets in our communities that maybe external graduates or even those not from the city don't even recognize. If I'm not from Dover, I may not know what a vibrant Main Street is and what a fantastic coffee shop they have, just as an example. So maybe we can talk a little bit about what, from your personal experience, what do you talk about in terms of 2 or 3 top things in the community? And maybe we'll let's start maybe with Newcastle County, go down the line there. Would let's see, from St. Francis, Helen, anything that you'd like to add in terms of lifestyle opportunities there that folks like to do in the area?
I think I'm from Pennsylvania myself, but I enjoy the drive into Wilmington, Delaware. You've obviously got the riverfront. That's been a growing area. A lot of kind of areas to live, work, play, I think they call it. So we have that. And then I think a lot of our physicians are also love the fact that it's so close to Philadelphia if they want to go to Philadelphia to get a little bit more entertainment. I think the area that we live in, just in general in this mid-Atlantic area, offers a wealth of opportunities. Whether you want to be in the countryside, you can drive a few minutes and you're in the countryside, or you are, enjoying an opera or something, or a ballet in the city. I think for all of us in general, it's just a really great place to experience a wealth of cultures.
Thank you, Helen. And thank you for making the point about cross-border as well, because this northern tip of the state is this narrow tip which kind of borders many areas. So from the, you don't need a visa to go to Pennsylvania and New Jersey and or Maryland. And, there's tremendous opportunity just north of Wilmington as well, in Kennett Square and in Longwood Gardens, nationally recognized places with historical ties, in fact, to Delaware. So that those are certainly no less important than right in the city. So from Christiana Care, Frank or Lauren, would you like to speak a little bit about, I know that Christiana Care is across the state, but perhaps more from the Newcastle County, Wilmington area perspective, anything that you'd like to highlight?
Yeah, thanks, Dr. Khan. I'll just add the obvious point, as was mentioned earlier. We are now offering services in 4 different states. So one of our, I would say, competitive advantages in many ways is the opportunity to speak to physicians from all of those states. And it's not uncommon, of course, that we continue to hire outstanding physicians who might be working for other health systems in Delaware County, Chester County, Pennsylvania, Northeastern Maryland, and even South Jersey. So, while we certainly highlight all of the offerings and attractions here in Delaware, we want to make sure that people are aware of those, and we offer them services and programs around relocation and access to relocation realtors to be able to get that information. While we want them to be able to live in the community that they serve. At the same time, we don't mandate that, certainly. And I think by doing so, we have that flexibility that allows individuals to perhaps stay where they are and still be able to carve out an appropriate career here with us at Christiana Care. So I think it's an incredible advantage that we have based upon our location.
Thank you, Frank. That's very helpful. Kim, from your perspective in Westside, and I know again, Westside is not just in Wilmington, Newark, and other places as well, but we'd like to speak a little bit about what are your providers like doing? What do you market about Wilmington and the area?
I too am from Pennsylvania, so I'm originally from Philadelphia. So I've been learning myself about things to do in Delaware and around. But again, people do enjoy the riverfront area, getting familiar with the arts and that kind of thing. And the biggest thing ever are the beaches. So we do have folks who love to go down south and participate in, beach life and, Rehoboth and things like that. So that's what we pretty much promote around the area. It's a small state, so I'm learning how to maneuver and find things, but we do offer work advantage where we give it to our folks and let them have, there's a code that you can use and find things for a date night and things to take the kids and things of that nature. So yeah, we do help with that as well.
Well, thank you, Kim. That's very helpful. How about Dover? What's happening in Dover these days, Stacy?
Well, I couldn't tell you how many cups of coffee I get from the House of Coffee. It's one of the places we always, if I have a coffee lover, we always hit there. It's a cute little boutique kind of coffee shop. But I think, Central Delaware and, in our Sussex locations, the boutique restaurants, the mom and pop places have definitely come a long way from where they were 10 years ago. So it's nice to kind of show places, I always ask about culinary preferences, before people come, any restrictions, any things like that. So I don't know if anybody is ever in or near Milford, but we always recommend My Sister's Fault and things like that. Additionally, the state parks are huge, especially for families. Last year, Bay Health gave every employee a state park pass for the year and just really encouraged us to spend time with their families and get outside and enjoy Delaware. And I think it kind of spreads over into what we share with our candidates. If you're having a great time at Killen State Park on the weekend, and you definitely share that. The beaches, like you said, are always a draw. We try and get them into the lesser known, like Cape Henlopen, things like that are just truly local here. And just kind of off the beaten path places. I think in Dover we have a very large Amish community, so that's very unique to many people, and many people find that intriguing. So we'll recommend places in the West Dover area that they go and frequent, and often become those staples that you go to certain butcher shops and certain farm markets and things like that. So you just try and kind of impart those, hey, I've lived here forever. So, here's some kind of insider secrets, and hope that they're, catching on as much as they have in the past.
Thank you very much, Stacey, and thanks for highlighting My Sister's Fault, which is a terrific, it's a Puerto Rican bakery, and my Puerto Rican friends remind me that their casitos and their café con leche is fantastic. So, and the House of Coffee, which is probably one of the best coffee houses in Delaware. And I'm glad for once my BB colleagues aren't here, because they'd argue about Lewis having that best coffee shop down there too. It's a close competition. So very good. Did you want to jump back, Kim? Do you want to go ahead?
Oh, I just wanted to tell Stacy I'll be stealing the state park idea.
Hey, this is all for stealing those good ideas to recruit our colleagues to Delaware together. So please share those good ideas. Jillian, do you want to add something from your perspective from Tidal Health in the Sussex County area?
Absolutely. So I just wanted to say that because the system's kind of spread out, there's a location for everybody. And I think my favorite part as a recruiter is to talk about, like, what's your family life look like? What would be the best for you? But I think the providers that thrive with Tidal Health the most in our locations are, people that want to be close to the beach, but have a little bit more elbow room and not want to fight some of that summer traffic, which I'm from lower Delaware. So traffic to me is like getting behind a tractor. So it's just a really neat area that if you love to be outdoors, if you love to go kayaking with your family, or, have picnics on the beach, but you can be close to the beaches and have wonderful, delicious meals in, 20-30 minute drive in a rural community. One of the nice things I think about our area as well is, yes, that we want the providers to come and work for, our systems, but there's also spouses involved that don't work for the systems. So one of the best things about our region is, we have bustling industry with lots of other job opportunities. So we have a lot of connections with Purdue and Salisbury University and, lots of other places for spouses to find work that they love as well, which I think is a huge asset. A little, tidbit that I was thinking about as well is, anytime we have somebody come on site for an interview, we offer them a community tour. So we have partners in the community that will take you and drive you around to show you some of the different areas where providers live, show you some of the best places that they like too, because they go to different restaurants than I probably go to. So if you're offered a community tour on an interview day, please take them up on it, because it's the best way to see the area. We can talk about our areas as much as we want, but it's different than driving around and actually seeing it. So something to think about, just take them up on that opportunity, because that's great.
Thank you, Jillian. I'm glad you mentioned that. And Fernando, I see your hand as well. And I just want to amplify Jillian's point about community tours. So as the Alliance, one of the key things we've recognized is that even for the residency programs in Delaware, they tend to be fairly sequestered in their communities, whether you're, in Milford and Dover, or whether you're in Lewis in the future, or the city of Wilmington or Newark, you tend to kind of be in those communities. So we're working with the state and the treasurer's office to create a community tour program for residencies for all these programs, so they can actually once a year, for let's just say a family medicine residency retreat from Christiana Care or St. Francis, or a pediatrics residency retreat from Nemours, have the program directors organize a retreat in a community which they're not as familiar with, which they could be exposed to and have a lot of fun in, and kind of learn about different part of Delaware. And all of your program directors have been part of that conversation. But from the recruiter perspective, if you think that is important, please feed this back to your residency program directors and say, we should be doing this in residency to expose these folks to Delaware, because they're the same ones that you want to recruit a couple of years later. Fernando, please go ahead. Tell us a little bit about the wealth of opportunities that Nemours has, and I'll point out the unfair advantage you have because you essentially have the estate right there. So Fernando, please go ahead.
Yes, so similar to Jillian, I like to think we also have the location for whatever you like, whether it's being exposed to the Amish culture and environment, whether you want to be, you like the fall and the different colors of the leaves, or in the beaches in the Caribbean and Florida, and being exposed to all types of just delicious food and culture. We've got it all for you. So we have many options, and I like to also touch upon, I think it's the gold standard, and now it's becoming more of a standard regarding community tours. It's important to keep in mind that we're not only recruiting that provider, but we're also recruiting their family. So it needs to fit, not only from a clinical business perspective, but also from a family perspective, to make sure that you understand what the family dynamics are and making sure that it's a good long-term ROI for all stakeholders involved. Thank you.
Well, that certainly makes sense. Thank you. And as someone who went to college in Philadelphia, the idea of going from a vibrant Market Street to the beach in less than a couple of hours is ludicrous. Right? That doesn't happen from Philadelphia. But guess what? From Wilmington, that does happen. And again, as somebody who grew up here, may have been here longer than several of you as well, don't underestimate the city of Wilmington. It's actually a very vibrant place. Our Market Street is vibrant. We have amazing, rated restaurants right downtown, chef-run places. For example, you go down to Lewis and Seaford and other places, and they have fantastic, fresh seafood restaurants as well there also. But we also have other things. We have, believe it or not, we have clubs and speakeasies, and we have the state parks, and we have all the rest of it. But folks need to come and explore that, and there's a great opportunity to do it. So for the applicants, keep in mind, in Delaware, it really is a microcosm of what the United States offers, not just in terms of patient demographics, but really in terms of experiences. And that, I think, being a small state from tip to toe, we got kind of hills in one area, we got beach in the other. You can, in 100 miles, traverse essentially a major part of the geography of the mid-Atlantic. So keep that in mind. Jillian, is your hand still up, or do you have a question, or was that from before?
No, I wanted to add something that I was thinking about that's really specific to Delaware that I like to talk to Delaware candidates about. Delaware, especially in the lower part, a lot of our providers utilize school choice. Because, if you have to live close to the hospital, but you want to take advantage of the schools closer to the beach, as long as you're willing to drive, there's applications you can put in to send your children to schools that aren't currently, what you're districted to. So we have a lot of providers that utilize that as well. So they can live kind of rurally, but, choose some other schools, which isn't the case in Maryland. So just something to think about. That's a real advantage for Delaware.
That's terrific. Thank you, Jillian. Mm-hmm. And let's see, Pam, did you want to add something from the perspective of not just local opportunities, but maybe expanding the conversation just a little bit? One of the questions we get is around education. And as several of you have pointed out, we're recruiting families frequently, not just individuals. So their questions are around, what are Delaware schools like? And as somebody who went to school in Delaware, I have a certain answer to that question. But folks ask about that, and there's a perception that Delaware's public schooling is different than it used to be a while back. And I think these perceptions are important to address, and I think we do them quite well, actually, with the diversity of educational offerings we have across the state, not just in public, but parochial and private and other opportunities too. So I was wondering if Pam, do you want to talk a little bit about what your experience has been and opportunities around Delaware, and then we'll segue from there to maybe some educational opportunities that I'd like to hear other people's perspectives too.
Absolutely. Thank you, Dr. Khan. I mean, as you mentioned, and as Jillian mentioned as well, Delaware offers for parents and those with children who are school aged various options around what education can look like for your students and your children, right? So we have a plethora of public school districts that offer education in the systems, right? And within those districts, we also offer, the state also offers private or charter schools, right, that each have their own niche. We have science and technology focused charter schools. We have arts focused charter schools. We have language focused charter schools as well. In addition to the public school system, there's also, as Dr. Khan mentioned, the parochial school system, the private school system. There's homeschooling networks if you're interested in homeschooling as well. And from a higher education opportunity and perspective, Delaware offers two-year colleges and universities, as well as four-year colleges and universities for undergraduate, as well as postgraduate opportunities. While Delaware does not have a state medical school, we do have the Denver program, which is the relationship between the state of Delaware and our medical education partners, Sidney Kimmel Medical College at Thomas Jefferson University and the Philadelphia College of Osteopathic Medicine. This partnership secures a minimum number of admissions seats for qualified Delawareans. And our education partners in this space continue to exceed those contracted amounts, which speaks highly to the Delaware medical application or applicant as well. I think one other thing that's unique to Delaware and may tie into education, but also just passion, there's Delaware's small, and there's something to be said that because of Delaware's size, it's small, but it's mighty, and we're able to get things done here, right? And so we have legislators at the state level and at the federal level that are accessible. And so if you're interested and passionate about medical policy, there's an opportunity to get involved from those perspectives as well, and champion change and impact for the quality of care and access to care here as well. So I think Delaware has a lot of unique characteristics that we've offered. So I've spoken enough. So back to somebody else for to weigh in as well.
Thank you. Well, Pam, you're well qualified to do that, because I know, like me, you went to high school in Delaware as well. So that's very helpful. Would anyone else like to comment on any aspect, not just education, but any aspect of lifestyle or the family aspect of being in Delaware? Lauren, I think you were first here. Please go ahead.
Oh, thank you. Just to finish off and round off the educational opportunities in Delaware, I was also thinking about the educational opportunities that Christiana offers their providers. I mean, to every provider on this call, thank you for what you do. Thank you for all the education you've gone through to become the expert in your field. And if you want even more of it, we also offer our providers that are full-time. It's continuing medical education, of course, 5 additional paid days off plus $5,000 every fiscal year to do continuing medical education. And then we also offer annually tuition reimbursement as well. So if there's additional, doctorates, master's degrees, etc., Christiana Care will work towards funding that with a certain amount every single year. And I was able to benefit from that program as well. So it's near and dear to my heart and absolutely accessible. So can't say enough nice things about not just the CME, but also the tuition reimbursement.
Lauren, thank you. I'm glad you actually brought that up. One of the applicant questions was actually around that. And I'm not sure we actually have these formal programs in place, but applicants who are looking across the country, they're frequently looking for MBAs and MPHs and things like that. And the question was, do any of the institutions have a formal relationship with the university to partner with giving an MBA or an MPH? So I'll throw that out to the group. Are there any partnerships that you all have with universities, degree granting institutions for your attending physicians and providers to be able to obtain an MBA or an MPH or a similar master's level degree?
Well, I guess I'll just finish it off there. So with ChristianaCare, there's Wilmington University, of course, there's University of Delaware as well. There was a program that was instituted, I believe, at the University of Delaware, where they were calling it a pocket MBA. And that program was instituted. It was an MBA in a condensed time frame. The University of Delaware partnered with Christiana on because they understand and respect the amount of time someone needs to dedicate towards an MBA, but also dedicate towards the provider's career. So it was condensed, and they were able to achieve that in a shortened time frame. And that was a great thing. There was a great handful of folks. I'm hopeful that we're going to, continue to go forward with that. And of course, I know I just mentioned a couple local universities. That tuition reimbursement piece doesn't have to be just for Delaware-based schools. I mean, anywhere in the country or the world that you'd want to go to.
Thank you. Would anyone else like to weigh in on the education piece that their institutions may offer, either in partnership or any reimbursements? If you'd like to, you can either put that in the chat or applicants can reach out to you. If you'd like to speak to it now, certainly please go ahead. Very good. Well, I will offer to our applicants that Delaware does have several exceptional institutions, but our two large state universities, the Delaware State University and the University of Delaware, both offer a diversity of master's and graduate degree programs. And so providers are certainly able to talk with their bosses and carve out education time and be able to undertake those programs. And for our recruiters, I would say, I think we are getting this question more and more around what these programs look like. And I think, just thinking as a group of Delaware leaders, it probably does make sense to think about what those programs look like in the future for our new folks coming in. They're interested in education, and should we be developing some collaborative programs with educational universities to develop healthcare specific MBAs and MPHs and things like that, that we could help them with. Fernando, please go ahead.
Yes, sorry, I'm having issues here. I'm trying to raise my hand. Yes, so the Moores offers both also. I know we have specific, I can't remember the names of the universities and programs we have in Delaware, but I know I read an email somewhere that is a service that we have. I know we have several thousands of dollars every year that we reimburse individuals for when it comes to education. So we have it. And I think that for the most part, most organizations do have something similar to that. Some may have more robust, but it's something that I think that you as an applicant are looking to work for an organization need to also consider and ask when you're talking with recruiters like ourselves here. And for the most part, I think you'd be very pleased that we do offer that.
Thank you, Fernando. And Helen, I see your hand up as well. Please go ahead. I thought I saw Helen's hand up. You may be on mute, Helen, if you're speaking. There you go.
I was on mute. Thank you. Yes, so Trinity Health does offer like tuition assistance. I was just thinking also, and continuing education. I was also thinking on the other side of that, when it comes to loan repayment, that comes up quite a bit for some of the physicians that are paying for their education. We do offer loan repayment options, and kind of piggybacking on what Pam was talking about and legislation in Delaware. I do believe Delaware passed legislation, was it just last year, regarding the hospitals partnering with the state for a state loan repayment program for specific specialties coming out, family medicine, including OBGYN. And in talking with the leaders at St. Francis, that is a program that we would partner with the state to offer substantial loan repayment for physicians that qualify over the course of, I believe it's 4 years. So some really good opportunities there to stay in the state and have a substantial amount of your loans paid.
Thank you, Helen. And that segues to our final couple of questions here as well. And one of the questions, I might just give an overview of that response, was around opportunities for physicians to join, but conduct research and participate in research opportunities, which I really want to, not every institution does research or defines it the same. But I interpret that as to join in a clinical capacity, but to have time for other activities that are educationally and professionally fulfilling, whether they be research activities or they be leadership roles. And I think all the panelists have spoken about that. All of your institutions do offer opportunities for leadership, for development in those ways, to carve out time as medical director and so forth, administration. And some of your institutions, I know personally, because I participate in on those committees, are part of research consortia like Delaware IMBRI, like Excel. And so certainly Nemours, Christiana Care, Bay Health, others are part of research consortia. So I think there's no one size fits all answer to that, but I think the best thing is to talk to your recruiter and talk about opportunity that you might be able to develop for research, and then see what that particular job opportunity offers. So that would be my response to our applicants. But if any of you guys would like to amplify that or make that specific to your institution, can pop that in the chat, or please let us know. The last question I think that Helen just touched on was around loan repayment and what loan repayments may offer. Pam and I can touch on the ones that are offered by the state, because we helped develop those through the Alliance. One of them is the one Helen referred to as the Healthcare Provider Loan Repayment Program. That is our newest program in the state of Delaware. Offers up to $200,000 over 4 years. And these are for specialties of particular need in Delaware. Primary care specialties, primarily ambulatory. So women's health, psychiatry, family medicine, internal medicine, outpatient, and that type of program. There is an application process. This is the pilot year. And my good friend, the late Sherman Townsend, Dr. Nancy Fan, myself, several others, we worked on that for a few years, and we're very pleased and proud that's a Delaware-specific program. Then there's the federal program, which is administered by the state, called the Student Loan Repayment Program. And that focuses more on serving in areas of need, geographies of need, and that has some particular criteria. So the information about both of those are available on the website. We'll put that in the chat and the recording as well. But there's brochures on each, which kind of look like this, and we're happy to share that with any applicants. I did want to ask the colleagues if they have any programs at their institutions that they'd like to mention above and beyond the HCP-LRP at the state level, or the SLRP, which is a federal program administered here. If any of you would like to amplify on any programs or tuition assistance, not tuition assistance, sorry, but loan reimbursements that you offer for new recruits, please go ahead. Frank, I think you were first. So Frank Gallagher, Christiana Care, go ahead.
Yeah, thanks, Dr. Khan. So here at Christiana Care, we have offered internally developed homegrown loan repayment program for primary care physicians for about 8 years or so now. It's been very successful. It's gotten increasing traction over the last few years in particular. As you said, given the new programs available with the state of Delaware, we are learning how to integrate the two programs so that we can offer the most robust rewards and amounts to prospective candidates. So thank you for all your work on that.
Of course, no, thank you, Frank. That's a great program. That institutionally offered programs augment the others, and that is wonderful. So thank you. Jillian, from Tidal Health's perspective, please go ahead.
Thank you. Yeah, I just wanted, I feel like every other answer I've given, it's been kind of like a moving target and a flexible answer, but we are currently partnering with the NHSC to make sure that we are on their list as well as underserved communities, so that, current employees can take advantage, and also, providers that are currently under an NHSC can move to us and bring their loan with them. So there's other federal programs for underserved rural areas that you can take advantage with at Tidal Health as well, along with just our finance group are really trying to make sure that that's a selling feature as well. So each contract we discuss what that would look like with every candidate. So something that you need to make sure your recruiter's aware of, and something you're interested in, so that they can advocate on your behalf. But I would say sometimes the rural, especially Tidal Health, Nanticoke, and Seaford, has a more of a rural patient base. So we're able to take advantage of a few more federal loan repayment programs.
Thank you, Jillian. And just so everyone knows, NHSC is a National Health Service Corps, and folks in medical school who undertake an NHSC commitment then have to serve in an NHSC area. And by definition, those areas tend to be those of high need, and those are typically areas, rural areas, sometimes urban. But in Delaware, NHSC qualified areas are mostly in Western Sussex County, and to some extent on the eastern side as well. And there's some in Kent. And the federal loan repayment program, as you all know, focuses on HPSAs, health profession shortage areas. In fact, that's why we developed our other state loan repayment program. You don't have to be in a HPSA or have to be an NHSC scholar to get our HCP LRP. You can work anywhere as long as in one of those specialties, which really, I think, then evens the playing field a little bit for the programs or the health system that aren't based in either the city of Wilmington or in rural areas. It kind of gives our provider the opportunity to work anywhere and try to reduce cost as a barrier. So thank you very, very much, everyone, for these wonderful responses, and to our applicants for submitting our questions. And I know you'll get a great number of folks, hopefully from our own programs in Delaware, applying for these jobs. And please remain in close touch with Pam and I about these, and we will with you as well. Pam, let me turn it back over to you for closing.
Great. Thank you, Dr. Khan. I just want to thank, echo what Dr. Khan said, but also, and thank everyone for joining us today, our attendees who are joining us live, those that will be viewing later, and especially our panelists. This is one of my favorite events, and I really think that this event and this discussion today just so wonderfully highlights what makes Delaware so special. Everyone here together, lifting each other up for what's best for Delawareans, right, as we serve them in their healthcare needs. And so thank you again. I just want to reiterate some key themes that I heard from our recruiting partners. If you saw something, please submit. If you didn't see something, but you're interested in these health systems, please still submit. And I think one of my biggest takeaways from our recruiting partners today was they're not just here to advocate for the health systems, but they're here to advocate for the candidates. So keep that in mind as you have conversations going forward. And thank you again for being with us. Just lastly, again, just an acknowledgement of all of our key partners here today. And as you're interested in submitting to join any of these health systems, please feel free to email your information and CV, resume, and letter of interest to pgardner@dhsa.org. We thank you again for making this another successful year, another successful event. And another successful year of partnership and collaboration for Delaware. So thank you all so much. We look forward to having you join us. Take care.
Bye-bye. Thank you, Pam. Take care. Have a great weekend, everyone.
Thank you.
Thank you, you too.
Thank you so much.
Thank
Bye-bye.
you.